Hi, everyone, and welcome to the World Doc Allen podcast. I'm excited about the program, World Doc Allen Lindeman. Doc, what's going on? How are you?
Well, I'm great. Thank you, Neil.
All right, so we're going to go and continue in our conversation of breastfeeding. And then we talked about why breastfeeding, all the things, the challenges of breastfeeding. What are they, and why should you not give up? Because a lot of people start breastfeeding and then give up.
Well, probably the biggest challenge of breastfeeding is latching on. And the way you get babies to do that is you put the bottom lip on the bottom of the areola, as this brown part of the breast around the nipple. Babies can latch on better that way. Years ago, before insurance hijacked medicine, we could keep moms in the hospital until babies latched on. We made sure they were ready to go home. Today, that's not the case. They're shipped out in a day, and nobody really cares whether they're ready to go home or not. What we see here is that there are twice as many babies at 6 months for failure to thrive in the moms who have vaginal births because they don't get to stay in until they're ready to go home. C-section moms stay longer.
And then they have more difficulty doing the breastfeeding if they're staying longer with the C-section.
The C-section really... The nurses are then able to help the mom and able to make sure that the baby can latch on. So it works better. The longer they have, the more education.
The more education. So what recommendation in education is that when they just have a vaginal birth to make sure that they go back and go ahead and get the education needed?
Yes, they should know. You know, there is such a thing as lactation consultants, but I don't think they come to visit the home, which would be ideal.
So just having to find that information and especially ask that information before you leave the hospital and get that info is one of your biggest recommendations.
Absolutely. And, you know, babies should gain, they should double their weight at 6 months. They should triple it at a year. And, you know, your goal is to get them to gain weight. Now, some people say you can't breast and bottle, but there are many women who do successfully without confusion.
All right, fantastic. Best place to find information and join your membership site is go where?
WorldDocAllen.com.
All right, that was the World Doc Allen Lindeman podcast, guys. Take care.